Hello, everybody. We are going to go ahead and get started. I'm Molly Robb, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I'd like to thank you all for joining us and welcome you to the webinar. Thank you for answering the poll questions. This is helpful information for our presenters. We've muted your phones due to the high number of participants attending. So if you're experiencing any technical difficulties or have any urgent questions, please use the Q&A pod located at the bottom of the screen in front of you, and we will do our best to assist you. We will also answer questions after the completion of the webinar. You will find the PDFs of the webinar, PowerPoint slides, and other webinar relevant materials in the top right corner of the screen in front of you. Lastly, you will receive an email with a link shortly after the conclusion of this webinar to complete a short and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible in the future. Now, a brief introduction of our presenters. Jennifer Rolls-Roos is the Research Program Specialist for the CEBC. Her work has focused on children receiving services through public sectors of care, including the child welfare and mental health systems. In addition, Jennifer has been focusing on evidence-based practices and how more effectively implement them in real-world settings. She has a master's degree in public health from San Diego State University. Rhonda Williams is the Research Associate for the CEBC. She assists the CEBC Research Coordinator by providing research support, such as performing literature reviews and summarizing relevant published peer-reviewed research articles. Rhonda has a Bachelor's of Arts degree in psychology and 2 Master's of Arts degree, one in human behavior and the other in counseling. And now, without further ado, please enjoy this webinar.
On the CEBC. In 2004, the California Department of Social Services, Office of Child Abuse and Prevention, OCAP, contracted with the Chadwick Center at Rady Children's Hospital and in cooperation with the Child and Adolescent Research Center to create the CEBC. The website was launched in 2006, and the mission of the CEBC is to advance the effective implementation of evidence-based practices for children and families involved with the child welfare system. There are 2 parts to the CEBC. One is the program registry. The other is the selecting and implementing programs tab. The goal of the program registry is to provide a searchable database of programs that can be utilized by professionals that serve the child welfare, families involved in the child welfare system. If you look at the child welfare registry portion of our website, each program description contains easily accessible and vital information, including the rating that the CEBC has, citations and summaries, a brief description of the program, training, and contact information. The Selecting and Implementing Programs tab side of our website, the goal of it is to provide guidance and resources about the implementation of evidence-based practices, or EBPs, and that information is arranged in 3 subsections: the tools and resources, guide to selecting and implementing the EBPs, and implementation examples. Here's a brief screenshot of what you will see if you go to our website. And here's another brief screenshot of what you'll see after you hit the Select and Implementing Programs. Hopefully everyone has had a chance to download our implementation guide. You'll need it for this portion, for this webinar.
And hopefully you have the handouts as well that are in the upper right-hand corner. We'll be going through those in detail, but you probably want your own copy of the guide and then the handouts for today as well.
And we will be, in our model today, we'll use the EPIS model, and it contains 4 phases. The first is the exploration phase, which we went over in the part one of our webinar. The preparation phase, the implementation phase, and the sustainment phase. What you're looking at now is the key steps in the preparation phase. This is what we'll be going over today in our webinar. Key steps in the implementation phase.
We wanted you to have slides that kind of showed all the steps in one place, so there was something, if you want to refer to that.
And the steps in the sustainment phase. What we'll be using is what we call County A as example. It's a mid-sized California county. It's a mix of rural and urban areas. As you can see, the place placement disruptions are going down. From 2011, they were 21.5%. Now they're in 2014, they're approximately 18.9%. They're all higher though than the state average and the CFSR standards they should be. County A exploration summary. This is a completed
This is the summary of what we did during the part one of the webinar.
Yes.
So we went through the exploration steps in detail, and at the end we reviewed the written roadmap the county put together. They identified several action steps, including some work on their screening and assessment process, some looking at their crisis stabilization services, possibly making some changes there. They identified piloting MTFC, multidimensional treatment foster care for adolescents in their county. And it also identifies making some minor changes to their team decision-making and RAP programs. So for today's webinar, we're going to focus on the piloting of the new program, multidimensional treatment foster care for adolescents. And we actually just learned recently that MTFC is changing their name. So that will be, I'll use the term MTFC here because that's what I'm used to calling it.
Yet.
And I am not really sure. We'll be updating that on the CEBC shortly. It's happening as we speak. Okay, so
if you have any questions, go ahead and feel free to use the question and answer pod that you may see. I think it's in the
should be at the bottom
of the screen.
And then as we get towards the end, we'll go ahead and address questions at that point.
Yes.
All right, so I'm going to go ahead and pull up the the webinar handouts, and we'll be using those for the majority of these. Let me make sure I do this correctly. Okay. Oops, sorry. Okay. It's not working. Okay, I'm going to use this, I think. All right, so we're going to start with preparation, and as we mentioned earlier, we have already done the part one on exploration. If you did not attend that webinar, you can access all the materials on the CEBC website, the handouts, and the actual webinar itself if you want to go through it. So hopefully most people have either attended that one or have reviewed those materials. But as we said, just to give you a quick update, we're really going to focus on MTFC, implementation of that as our focus for the examples today. And we're going to start with preparation. And the preparation phase is the second phase of the implementation process. And this is really what we would call the planning phase. So you've made a decision to adopt or implement a specific program, and now you are going to do all the preparatory work to get ready before you actually go live with anything. Thank you. The first thing at the preparation phase is to ensure the leadership buy-in. During exploration, an implementation team was set up, but now that you've decided on a specific program, you may need to pull in different leadership. In this case, they're working with MTFC, which is a treatment foster care program, so they likely need to pull in some folks from the child welfare residential system. They might need to pull in foster parent association if they weren't involved, or those sorts of people. You also want to ensure that you've got leadership buy-in at the top of the child welfare agency. If they're not involved directly in this work, then there needs to be a consistent feedback loop so that they are kept apprised of what's going on. So once you've got your leadership buy-in, you've got your implementation team, then you really are going to work on developing your implementation support system. So that'll include things like contracting with the program developers, making your plans for data and outcomes, assessing fidelity, and then also what are the general resources that you're going to need for implementation. I'm going to reduce the screen a little so we can see the whole thing on one page, see if that helps. So contracting with program developers, this will vary a bit. Some of the programs that we have on the CEBC have very strong implementation arms. So for example, MTFC has an entire corporation that's out there to assist you with implementation of MTFC.
Mm-hmm.
So in this case, you would probably need to have a pretty formal contract with the developers, and they're going to have a whole wealth of resources that you can use for implementation, preparation, implementation, all the way through sustainment. Other times, though, there may be a less formal structure. So you're going to have to kind of, depending on the program that you're implementing, you need to think about what sort of arrangement you're going to make, what the role of the program developer is going to be in the implementation. In the example of MTFC, it can be a pretty tight relationship with that implementation arm. They can often help with things like developing a timeline for when training, coaching, all the different steps will occur. Usually you'll want to set up some sort of either a formal contract if there's going to be money exchanged, or at least some sort of MOU, so that you're both clear on what the responsibilities of each party are and what the expectations are. And then, of course, things like costs. How is this going to be paid? You want to know what the costs are up front. Much of this was already hopefully determined in the exploration phase, because cost is such a big issue in selecting a program. If not, you want to hammer this down pretty quickly in the start of your implementation work.
And you also want to make sure you find out who is paying for the cost
Yes.
as well.
Yes, exactly how it's going to be paid and who is important.
Yeah.
In terms of data and outcomes, as you're beginning the preparation phase, you want to make sure that you have clearly established what the goals and objectives are for the program. And this is an area that we often see that communities and agencies have difficulty with, is coming up with the written goals and the written objectives of what you're going to do. And so we've provided some information in this resource that will help you, make your objectives very specific, very concrete and measurable.
Mm-hmm.
In the case of MTFC, you might have a variety of types of objectives, things like more of a process objective, such as how many youth or families will be involved in MTFCA in each time period. But then you also might have other objectives related to placement stabilization or behavioral issues in youth, satisfaction with services, and so on. And so for each of these, you're going to want to make sure that you have created what are commonly called SMART objectives. I think we just lost the internet connection going on there. Can we pull up the chat? Can we pull up the chat window so we can see if people are losing this? Because I just lost it on my side. Okay. Wow. Yep. Okay, we are definitely having technical difficulties. We just got a notice that our internet connection went down. It's back. Okay. Sorry. Oh goodness. We are not having a good day. I'm very sorry about this. All right, so let's go ahead back. So specific, your SMART objectives should be very specific, exactly what you want to do, be measurable. So use counts. How many people should it be? If it's a number served, if it's a percentage, 80% of your clients will receive X number of services, and so on. But make sure that it's achievable, that it's reasonable. So I don't like to see too many goals that say 100% of people will do this. That's probably not reasonable from right off the bat. So you want to take into consideration, again, realistic or relevant, depending how you want to define the R, and then time phase. So you want to put a time nature here. And again, objectives, oftentimes the developer can help you with that. They may have some objectives based on their own research, but you want to make sure that it fits with your community. So we've given some examples here. So talking to developers is always a great idea. Looking at the research on the programs, if you're not sure how you're going to measure the outcomes, try looking at some of the studies that have been conducted. What are the outcomes they've seen? And then in terms of initial measurement, we always would like people to have some baseline measures. So if you're implementing a new program, what was there before? What was your placement disruption rate before you started this program? Had you done any sort of satisfaction measures with group homes or foster care? Did you have any other things that you could look at for historical data?
And during the preparation phase, you're going to want to think about how all this data is going to be collected, who's going to do it, is it going to be paper, is it going to be electronic, and so on. So a lot of detailed information that you're going to have to think about. If you're having multiple providers delivering a service, how are each of them going to report the data, how often, and so on. So what we're trying to provide here are a lot of different kind of thoughts for you to be, thinking about, and different issues you need to address as you move through the process. Similar here, we've got assessing fidelity. A lot of times, again, developers will have fidelity tools that you can use, and we have information on this in the CEBC if they've identified that they have fidelity tools. But you'll need to think about the format of those and how you will integrate that into the service delivery system. And if fidelity tools don't exist, you may need to work with the developer or do some work on your own about what are the key elements that you would want to see assessed if you were to examine fidelity. Lastly, in preparation, you're going to want to think about the resources that are needed. We have information on this on the CEBC, but you're also going to want to talk to the developer who may already have an established list. But these are just some basic things, space, audiovisual equipment, printing, materials that you're going to need. So it's putting those lists together of all the possibilities early on so that you can start making plans. And we often tell people to expect that the preparation phase will take 6 months from start to finish, and it could be longer depending on what you're implementing. Okay. Other key steps in the preparation phase would be working with your stakeholders. You started doing this in the exploration phase. Again, you're going to work with your stakeholders all the time throughout the entire implementation process if you're sure you've got them on board. Also, during the preparation phase, you want to do any sort of double checking you need to make sure that the evidence-based practice you've chosen fits with consumer concerns. You did some work on this during exploration, but now you want to kind of finalize it. And you want to address them if they exist. We talked about whether there were any cultural issues or if there were any subpopulations in your community that you had concerns about. In MTFCA, it's a treatment foster care model, so you may have some concerns from your foster care community or from existing treatment foster care providers about how this change is going to occur, what's going to be involved, and so on. So you want to make sure that you're addressing those at this stage and making sure that people are on board and feeling comfortable. And then, of course, money, always very important. Again, you did initial work on this during exploration, so you've already identified that you have a feasible funding stream for the program, but now you are doing a little bit more kind of finalization of that. And so, you're looking at how exactly are you going to fund it. Do you need to have if you're using something like Medi-Cal, Medicaid, public funding, do you need new billing codes established? How do you do this? How do you document services so that you can bill under whatever the funding system that you are using is? And some of this, is going to be things you've looked at already, but again, you want to make sure that you've thought about these during the preparation phase. And early on, I think we know that any changes you need to make to the billing system are going to take a long time, and so you want to get started soon. We have provided what we call a funding stream inventory worksheet. It's got some examples, but if you're still at the stage where you're trying to figure out funding for maybe parts of the program, so for example, if you're implementing a program that might need childcare or refreshments as a piece, and you're trying to locate funding maybe for that piece of it, you might want to use this to kind of keep track of what your options are and what the pros and cons are of the different funding sources. All of these tools and resources that we're looking at are part of the guide, and they're also available on the CEBC website, and ones like this funding stream inventory worksheet are available in a fillable PDF format as well. You can download each one individually so that you don't have to photocopy out of the guide or pull out of there. Okay. Probably what I would consider the most important part of the preparation phase is all the timelines. Again, we talked about a 6-month period. It could go quicker, it could take longer, but whatever you do, you want to make sure that you have clearly established timelines for how this is all going to move, and that as your implementation team is working, that you're accountable to the timeline. In particular, at this stage, you want to have a staff person who's kind of running the show. Whether this will be the person who will go on to manage the program, or whether you still need to hire that person, but you still need to have one person who's really in charge and keeping track of the timetables and making sure people are accountable. Some of the things that really become part of the timeline are the referral system. If changes are going to have to be made to the current referral system, you want to be thinking about how that's going to happen and when. What are the current referral systems? You know, is it self-referral? Is it direct referral from a worker? Is there a form that goes to a centralized unit, and so on? So there are all different things that you're going to need to think about in terms of how to adjust that system to meet the needs of the new program and what the timeline should be. For example, if you work with child welfare workers making a referral to your program, like you may see in the case of MTSDA, or there's a placement committee that makes decisions on placing in something like MTSDA, you're going to want to start your outreach to those individuals early, several months before you go live, so that you're prepping them, you're getting them used to the idea of what's coming, they understand how the transition is going to occur, and what the referral process is going to be.
Another important part of preparing for the implementation is make sure you have the correct amount of staff, the staff that the minimum provider qualification is calling for from that program. You want to make sure that if it calls for a master's level, that you have someone there who can implement on a master's level. If it's licensed interns, paraprofessionals, the staffing needs. Does the person have to be on call for 24 hours? Does it require evening or weekend coverage? And you might already have staff in the agency that can deliver the program, or you also might have to hire staff, so that's another consideration that you'll have to do. And also you have to consider the union issues to consider regarding moving or hiring staff. So that definitely is something that you need to think about when you're going to implement a program.
And I think MTSDA, going back to our example, is a kind of a unique situation in that you will have some staff who are more what I would call professional at the agency level who will oversee the program, but a lot of your actual staff who are delivering the service are the foster parents themselves.
Yes.
And so again, you will need to be thinking about how you're going to recruit these folks. Are you transitioning an existing treatment foster care program or system in your area to a new model, to MTSD? Or are you starting from scratch and you've got to go out and recruit people? How are you going to do that? Are you going to contract with someone else to do that, et cetera? So, not only is it the internal staff, but in this case, you've got kind of the additional issue of recruiting those foster parents who will deliver the service. And leaving plenty of time to get that done. It's important. Yes. Training and coaching, you want to build this into your timeline. Pretty much every program you can possibly implement is going to involve training your staff to do something new or do something different. Even a minor change, you want to make sure that you do some sort of formal training on that so it's clear what the expectations are. So going through this, it's knowing from the developer, and also on the CEBC we've got some information about training, but being clear on what the training requirements are, how long the training is going to take, who's going to do it. Yeah. Yes. One of the issues we often see, and this usually comes up during the exploration phase because we advise you to have these initial discussions with the developer. So for example, if you want to implement a model and the developer has to train you on it, but they're not available to train you for 9 months, that's going to throw your timeline off. So you want to know what the training schedules are, what the training availability is. For some programs, there really is no formal training. You may be, some of these programs are more manuals that you use, or the developer doesn't have a formal training arm, but you're still going to want to do training for your own staff, so you'll need to look at how all that will occur and what the timeline will be. There's also the issue of ongoing training. So we certainly recommend that when you begin a new program, you don't just do what we call train and pray. You train and then hope that everyone got it. We hope that people will use coaching, will use ongoing training, booster sessions, to ensure that the training really sticks and that problems that may come up in the early phases are addressed. And we'll talk more about that in the implementation section, the next piece.
And while you're doing the training, you definitely have to consider the cost of it and who and how, who's going to do it, how it's going to be paid for. Will a developer participate in joint training with another agency, so you may be able to defray the cost in some way? And does a developer, they might even have suggestions about how the agency can cover the training costs as well.
We've often talked with smaller counties who've approached us, how can I implement program X? The training is too expensive. We can't pay to have the developer come in and do the training. Well, and one idea is, can you partner with other counties in your area? In California, we have kind of a regional training academy system. Can you put the call out through the regional training academies and see if anyone else has interest in partnering with you to share some of the cost? And so, I think there are creative ways, and you can, talk to the developer, the CEBC. We're always willing to try to give some assistance on overcoming some of the barriers that we hear about to implementation. Okay. All right, we're going to go on to the actual implementation phase. And I would say this is, implementation phase begins like when you are going live. So go live week is when it starts. And again, we're going to start this one off with talking about verifying buy-in. So when you are about to go live, you want to do kind of the touch base with all the kind of key folks, but you also want to touch base, it could just be an email or a phone call or, flyers that go out, but you're going to want to reach out to the agencies that you're working with. You're going to want to let everyone know that we are actually starting. We are delivering MTFC, and it's starting this week. We're all excited, rah, 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 kind of get people going on that. We referred here to a resource from the exploration phase, which is about the critical role of implementation teams as you move through EPIS. And the reason I highlight this here is just kind of remind you why we're keeping this team going. And really, I see the role of the team during the implementation phase as being more of like a problem-solving, boots on the ground. They're the ones who are out there in the field kind of hearing what's going on, and they can be sharing that with the team so that if there are any barriers that are encountered or problems, the team can get together quickly. Could be during telephone, or could be just a quick conference call, or even just email if that's what you need, to address any issues that come up fast so that your implementation doesn't get derailed. So this is just a reminder of what we're looking for. We're going to come back to monitoring and feedback later, but you're going to want to be thinking about this with your various partners from as soon as you're going live. And then you're also going to want to be keeping an eye on the billing and financial process right from the start. We know that money is key, so you're going to want to make sure that from day one that documentation is occurring, billing is going on, and that if it's not occurring, that you're addressing that quickly to kind of get people doing things correctly from the start. You're also going to want to have a way of checking on your reimbursements. So if you're submitting billing claims to a funder under your funding system, you're going to want to be tracking denial rates for those and make sure that you're addressing issues that go on. And again, start that from day one so it just becomes part of the normal practice.
And it'll help you be clear on whether the system is functioning properly. So that's another key reason to make sure your billing procedures are adequate.
Working, yeah. One of the other key steps in this phase is ensuring priority. So basically, hopefully in your timeline, you planned a time of the year that wasn't a crisis time. For example, MTFCA, you probably wouldn't want to go live the week before school starts. You don't want to do it right before the holidays. You want to try to find a nice, relatively quiet time. But we all know those are almost impossible to locate. So you want to ensure that you're getting as much priority as you can for your initiative, and you also want to think about emergency planning. So here we're here in San Diego. You know, if something were to happen, like we were to have a wildfire like we've had in the past couple years, that may not be the best time to try to go live, because a lot of our resources will be taken up responding to whatever this incident is or this emergency. So you want to kind of in the back of your mind have a contingency plan for, you know, would you back off? Would you just adjust your timeline so that you're not putting the, you know, demanding expectations? Or in the case of MTSC, where you're thinking about a housing situation, you may not be able to. Once you've started, you've started. So you want to be, you know, ensuring priority, but also thinking about some contingency issues of how you would address problems. In terms of completing the training, what this really means is that you want to make sure that everyone is trained before the start date, but also you want the training to occur pretty close to when the start date is projected to happen. We've seen situations where a community will do training and then it's 3 months before anyone actually delivers a service, and you are going to see fall off in people's memory of what they learned, and you know, you're going to want to have people be able to practice those skills pretty quickly. If you get in a situation like that where, you know, there is a time lag due to something beyond your control, you want to do some problem solving in terms of how you can kind of keep that knowledge level high. You know, maybe you would do some, you know, support groups or booster training, or, you know, have people get together to role play some of these activities, you know, maybe repeat pieces of the training on a more informal basis, but something to kind of keep folks sharp with what they learned, you know, even though they can't go live quite yet. At implementation, again, you want to make sure that your materials have all been prepared and distributed ahead of the start date, and you know, checking on quantities. Does everyone have what they need? How do they request more? In some communities, they'll set up, you know, a single email or a phone number that people can contact if there's an urgent need, if they don't have something. Again, you want to have a way to respond to a problem quickly so it doesn't become a bigger issue or snowball. And a lot of this is covered in this Go Live checklist at the bottom, so why don't we go over to that. And what you'll see here, and again, these are things that we've developed. We would hope that folks would take these and adapt them as needed for their own situation. But these are kind of the key things. You know, have all the practitioners gotten the full training? Have all the equipment, space, materials been secured? Has coaching and technical assistance been arranged? Are monitoring systems in place? So kind of all the essential pieces. We always recommend here the day before go live that there be some sort of, you know, mass communication, something kind of positive, inspirational, again, building some of the excitement for what's coming, maybe some last minute tips, reminders, and information on who to contact if there's any problems. So it could be that, you know, one email, one person, one phone number, who do they contact? Following up with your referral staff with any final instructions. So just prepping everybody the day before. And then we recommend you almost do the same thing the day of. You know, check in. How are things going? You know, has anyone gotten referrals? What's happening? Again, making sure that people are aware of what's going on and that you're there supporting them. Within 1 week after go live, you want to have some sort of concrete follow-up with the service providers. And this is where you can utilize your implementation team. Hopefully you've got some of your service providers on that team, and maybe you have a meeting where you talk about that, and you want to just ensure, you want to get an idea of what's going on. Are there any issues? You know, are the fidelity and outcomes monitoring pieces occurring? Is baseline data being collected, and so on? And then monthly after go live, we have the monitoring and feedback system resource, which we will move right to the next page. And this will, again, give you some suggestions of things that you can be monitoring, what your timeline should be. Please keep in mind that your specific intervention developer may have their own systems and timelines. So, of course, anything the developer puts out would take priority over what we've put together. But in case you're adopting a model that really doesn't have something so formal, this might give you some, you know, some thoughts to think about. We give timelines here, like on a weekly basis. you want to think about what the periodicity is of the treatment or the intervention that you're thinking about. It might be that, monthly data collection makes more sense, quarterly, again, just depending on how frequent contact is occurring and what makes sense for your community. So we can kind of walk through that. Some of the common problems that we've seen on the CEBC from programs that have implemented, and we kind of touch on some things for those. The first is high client dropout. So clients are referred, they start services, they do a visit or two, and then they just disappear. So what we would always say is, what's going on? You want to, can you do some follow-up with folks who've disappeared? Who just stopped coming? Can you do any data collection to find out why they stopped coming? Is it transportation? Is it the timing? If it's a group thing, is it the timing of the sessions?
They might not even understand the practice itself, so you might have to do more explanation of the practice itself. So.
And it could also be a need for more engagement. So you probably need to involve your direct staff, leadership, but how are you going to re-emphasize engagement with the staff from the very beginning? And it's as simple, engagement begins with the first contact that a potential family has with the program. And it's thinking about all of those things. What was the front desk like when they came in? What's the waiting room like? Is it culturally representative? Is it welcoming? Things like that. So if you're experiencing a dropout, again, get on it quickly and start thinking about how you can address this. And these are areas, again, the implementation team should be involved in. Another area that we've seen is that some models require the practitioner to participate in consultation calls. And normally these are pretty serious. They really want people to be participating in these. They're a booster part of the training. And it's a fidelity and a quality control feature. So if you're having issues with your folks not attending those, you need to problem solve that pretty quickly to make sure that folks are delivering the service as it was intended. Obviously, you want to make sure that all your staff have time allocated to attend the consultation calls. It shouldn't be, I couldn't make it because I had a client scheduled at that time. So we need to have protected time for these folks. And I think that tells the staff that training and the ongoing coaching and supervision is key and is very important. So you want to make sure that your managers, are reviewing the implementation process, the importance of these calls, and that if you are having people who aren't attending for kind of their own choice reasons, and that you're following up with them and you're holding them accountable that this is really part of what they need to be doing. This last bullet point here on caseloads, referrals not coming in. We have seen this several times. There's kind of this idea, if you build it, they will come. Not always. So we've had several counties who've talked about having a program, a great program, it's a good fit, they put it in place, and they really aren't getting referrals, or they're just trickling in. And I think here the issue is, looking at your referral pathway. What went wrong? Were you expecting to transition existing clients to a new service? Was there a good plan in place for how that was going to occur? We had one community where when they experienced this problem, they very quickly got together and retooled the service providers to actually go out and do outreach to the referral sources. And so they figured, well, they're not delivering services, let's have them become kind of a marketing tool. And so they were able to go to some of the referral sources and put a face to the program and talk about it, be able to talk to a person who would make a referral and let them see, who they were and what the program's about, ask questions they had. It can be hard when you have existing programs in place and people are used to referring to those providers and those programs. It can be hard to make that change, and so it may require a more personal approach. And that's why we talked earlier about it, how it's so important to reach out to all those stakeholders early on and have them feel involved. Examining outcomes, obviously, as you're implementing, this is going to be key. Hopefully you've got everything clearly in place of what you're going to do. You've got your requirements and your outcome expectations built into service contracts. You've got your measures determined. All this should have occurred earlier. But within the first month of services, you do want to start looking at some of the baseline data, getting some, what I would call more quality assurance data. Are some clients missing measures? Why are they missing? How can we address this? Are there certain items on the measures that are missing? These could be items that clients maybe don't feel comfortable answering, that you might need to address why people aren't answering them. We've had things where, to save paper, you use a two-sided form, and then you start realizing that a bunch of the clients don't answer the second side. Well, that's a training issue. You need to make sure that they're informed that there's two sides, or put an arrow at the bottom, or make some adjustments. You also want to be looking at whether the clients that you're getting, according to the baseline data, are really appropriate for the services. And this, I think, is part of quality assurance. You want to make sure that your referrals are appropriate so that when you're looking at outcomes, you have the ability to see the outcomes that you want. Sometimes we'll see folks referred to programs who really don't meet the level of severity the program was intended to address, in which case you can't see improvement because they're already at a level that's sufficient. So this gives you some ideas of things to look at, again, from the very beginning of implementation from go live. And then when you're starting implementation, you want to be thinking about scale up. And this isn't just expanding the program, but it could be adjusting staff to meet demand. So you might find that you went live in 4 different regions, and one region in particular is going gangbusters, and they could use more staff, where other regions just don't seem to be. So you need to examine whether there's a referral issue. Can you move staff from one location to another? Do you need to expand capacity in that region? Again, it's looking at what's going on and trying to come up with some explanation for what's occurring.
And you also need to consider the cultural issues that are in that region. You might want to make minor adaptations to fit that culture that's in that specific region. That might also be something that you want to explore.
Yeah. And a lot of times we recommend, if you're in a larger community and you have the ability to do this, go live in one region or one location first, and then do more of a staged rollout to other locations, so that you can almost use the first location as a pilot and kind of work out the kinks, and then roll it out to other sites. And obviously your ability to do this is dependent on the size, the number of how large you're talking about, how the training works, and so on. But we found a lot of good success with kind of doing a more staged rollout where you scale up over time and work out some of those problems in a small setting first. All right, so we've been talking about implementation. We would normally say that implementation, in order to go from go live day to fully delivering services with fidelity, you're probably looking at 6 to 12 months at least. And in some cases it may take longer. If you've made a really big change, it may take more than a year till you get to the point that you really feel like your program has been well implemented. So at that point, you want to start thinking about sustainment. So again, 6 to 12 months at least after you've gone live. And what we really mean by sustainment is you're in a place where you have fidelity to the model, you're getting the outcomes that you want, and you feel like you need to sustain exactly what you have as you go forward. And you want to build it into everyday practice. You want to make it part of your agency's standard policy and procedure. You want to have staff at your agency perceive that this is not just a demonstration or a pilot project, but this is now exactly what you're going to be doing as you go forward. So obviously in order to sustain anything, you've got to have the money for it. So we're talking here about long-term funding. Funding you've been thinking about since exploration, but at this point, you want to be thinking about, is the funding system that you're currently using time limited, or can this go on indefinitely? And adjusting your funding if you need to, if you don't have long-term funding already. And then also, what about the documentation and billing practices? Are those sustainable in the long term? have you incorporated any of these into your kind of larger agency-wide system, or or is there going to be kind of a standalone system that now needs to be incorporated into the main system, and so on. This, I think, is more common with grant-funded programs where you might get 3 or 4 or 5 years of funding to get something going, and you've got billing, or you've got documentation that's in kind of its own standalone piece. Now the grant is going away, and you need to figure out how to sustain this, but you also want to keep all the important pieces going, but you've got to build them into routine, regular everyday practice. Let's see, next page. Also during sustainment, you need to be thinking about how you are going to cover the ongoing training needs. So we've talked before about how having that training and coaching is so crucial. Can you build the training for this intervention into your existing training process for an agency? So if you have a new employee orientation training that occurs, do you build the training for this into that so that all staff get it? Do you have an annual training for all staff, and you can build the booster sessions into that, and so on?
And who also is going to cover the cost of the annual training sessions? Is it going to be covered by the current funding stream, or is it going to be incorporated in the reimbursement rate? So those are some of the things you also need to look at when you're doing the training.
Yeah. And when it comes to training, we often recommend that if you're going to sustain something, you're going to want to take more responsibility for training in-house if you can. Some developers will want to stay involved in the training and coaching, but if possible, bring it in-house. See if there's a train-the-trainer approach that you can do with the developer, so that now your own staff can train new staff and you're not reliant on the developer to come in. But again, that will depend on the specific intervention that you're looking at. Okay. And obviously you're going to want to make sure that you're going to be able to continue monitoring fidelity and outcomes as you move forward. So you want to be clear with your staff that fidelity and outcomes are a continuing part of what the program requires. Hopefully at this point you've got these well established and well built into your system, so they're just part of regular practice. They're not seen as something special. But you really want to internalize the fidelity monitoring function within your own agency to the extent possible. So it may be that you've been doing, the implementation team has been doing more of the monitoring and fidelity, and now you're going to want to internalize that, because at some point the implementation team is going to go away. So it needs to become the responsibility of the program manager, part of a contract requirement, or so on. And you need to determine how that's going to occur. And I think item 3 on this list of key steps in the process, what's an acceptable range of fidelity? You want to be thinking about that if you haven't already done that. When are you going to have the red flag go off that there's some issues that you need to look at and go forward? And then how will you increase fidelity if it does drop below a certain level, and what's that process going to look like? In terms of making refinements during sustainment, what you're really looking at here would be, could be some minor adaptations to the process itself. Nothing is ever static, so your county may experience changes in other areas, and that results in the need for adaptations to this intervention. And it could be, changes to things like the referral process. It could be changes to outcome and fidelity monitoring. So what are the adaptations or refinements that need to be made to adjust the practice so that you can continue in the long term? And again, of course, reviewing the referral process, having some system in place to make sure that you're continuing to get a level of referrals that's acceptable, that you're not seeing a drop-off over time. There's no point sustaining a program if you aren't getting sufficient clients to make it a viable program. We're reaching the end of our hour, so I think what we'd like to wrap up with a final message, and then we'll take some questions. And what we try to remind people is that implementation all the stages, beginning with exploration all the way through sustainment, is largely about thoughtful planning. So what are you, from the very beginning, what do you want to do, and going through the various steps so that you are ensuring maximum possibility of success is how I would think of it.
You want to make sure you're not just picking a program because it's a new and hot topic. You want to make sure that it fits your actual region, your customers, your stakeholders. You want to make sure something that you can sustain and not something that's not something that's just going to go away because you haven't done the planning necessary to make sure that it stays.
So I'm going to go back to the webinar handout. I think the key thing that I would say is the old expression, which is, oh, sorry, I went to the wrong one, which is, plan the work and then work the plan. So you figure out what you're going to do and then you follow through. And I'm going to get back to PowerPoint. Sorry, there we go. See if that comes up. All right, so question pod can be in there. And I see we've got a couple of questions at the bottom. So question, we have sometimes had issues about who owns the data collected. This can be very significant if you work with a university partner. We have excellent data which the university is blocking publishing. So I think this is a great example, and this often comes when you use an external evaluator, someone who's looking at your outcome. We talked in here about in the preparation phase how important it was to have a contract with the developer for what your expectations were. This is a good example of where you want to have an MOU for what the expectations are regarding the data. And I think it's really important when you're doing a university partnership that there's a recognition that the data, really does need to belong to the program.
Right.
It's your data. They may have been the ones who collected it. They may have been a partnership, but you want to be addressing that expectation up front. And a lot of times this becomes an issue if you're talking about a mental health service or something that would be subject to HIPAA, because in order to give that data to someone else, you have to have that business associate agreement. So you will probably have to have some sort of formal agreement in place regarding what your roles and responsibilities will be. And I think publication is key. Obviously at the CEBC, we want to see the data out there. So it's really disappointing when we know that someone's done something and they have an evaluation and we don't see publications coming. It sounds like in this case, the example here, the data is there, the university is blocking publishing. Not sure if there's much you can do after the fact other than to try to negotiate. And the difficulty here is that attorneys, universities probably have access to a lot better attorneys than individual agencies do. So unfortunately, it can often be a matter of clear it ahead of time. Maybe play to some of the altruistic issues, with the people you worked with, that they will also hope to see this information get out there. So, and again, certainly you can use the CEBC as a resource if you've got questions or would like some advice on how to work with university partners. We certainly encourage it, but getting those roles and responsibilities clarified up front is really key. We're almost at the end of our hour. I don't know if there are any other questions that have come through. I'll give it a second, see if anyone's typing, and if not, we will go ahead and wrap up. This webinar will be archived on the CEBC along with the handouts, so you can get those after the fact. And let me move to our next one. If you are not already signed up, I think we had another question come up. Okay, it seems like a lot of questions are about making course corrections when we didn't engage in thoughtful planning. Okay, yes, I think we should. Good point. I think we can do, we get a lot of questions about course correction, so we will probably do some additional work at how we can help people who get in that situation where things aren't quite going as they planned, especially when it comes to things like working with external partners and going forward. So thank you for that feedback. We also, of course, would appreciate any feedback on the guide. If there are additional resources or tools that you would be looking for, please let us know. The guide is in PDF form and electronic on the website. We've already made a couple of revisions to it based on some of the feedback from the exploration webinar. So we intend this to be a very dynamic document, kind of adding tools and resources as we develop them and as people have requests for additional things. So if you haven't signed up for the email alert to get information about new programs and content, we've got the address there to do that. And then, of course, if you have questions at any time, you can contact us at that info@cebc4cw.org.
All right, thank you everybody for joining us, and make sure to look out for the webinar survey, which will be emailed to you